This video continuation of inborn error of amino acid metabolism. Now we want to discuss glycine encephalopathy, also called as non-ketotic hyperglycemia condition. Glycine encephalopathy is an autosomal recessive disorder that occurs due to the mutation of any one of the genes. It may be AMT, encoding amino methyl transferase enzyme. First gene AMT, encoding for amino methyl transferase, or second enzyme GLDC, encoding glycine dehydrogenase complex. Glycine dehydrogenase complex, or third one GCSH. This enzyme encoding glycine cleavage system protein H. Glycine cleavage system protein H, causing defect in glycine cleavage system, also known as glycine decarboxylase complex, that helps in the breakdown of glycine. Glycine is an amino acid that acts as a chemical messenger transmitting signal in the brain. So glycine is an amino acid that acts as a chemical messenger transmitting signal in the brain. So the deficiency of glycine cleavage system causes accumulation of glycine in the body fluid, especially in CSF, causing neurological symptoms. Symptoms occur during neonatal period and it include lethargy, feeding difficulties, hypotonia, myoclonic jerking, and apnoea. After 6 months of age, intellectual disability and behavior problems are seen. Treatment include administration of sodium benzoate to reduce the level of glycine, anti-seizure drugs, and ketogenic diet. Next, inborn error metabolism of amino acid, maple syrup urine disease. Maple syrup urine disease is a rare autosomal recessive genetic disorder characterized by deficiency of an enzyme complex branched chain alpha keto acid dehydrogenase. Branched chain alpha keto acid dehydrogenase complex due to mutation of genes. First one is PCKDHA, branched chain keto acid dehydrogenase E1 subunit alpha. Second one is PCKDHB, branched chain keto acid E1 subunit beta. Then DPT, dihydrolipoamide branched chain transcyclase E1, and DLD, dihydrolipoamide dehydrogenase. These 4 genes code for the enzyme complex that helps in the breakdown of the 3 branched chain amino acids like leucine, isoleucine, and valine. The 4 genes, these 4 genes PCKDA, PCK, DHB, DPT, DLD. 4 genes code for enzyme complex that help in breakdown of 3 branched chain amino acid. What are the amino acid? Leucine, isoleucine and valine. The deficiency of this complex result in the buildup of these 3 amino acid along with their byproduct keto acid, which become toxic to the body. Accumulation of their byproduct keto acid result in metabolic acidosis. This amino acid and their product will accumulated, so it causes metabolic acidosis. There are 4 types of this maple syrup urine disease. First one is classic MSUD. It is a most common and severe type, and it occurs in the first 3 days after birth. PCK DHA, PCK DHB, TPT. These are the genes are affected. It causes metabolic encephalopathy and brain edema. So these 3 genes are affected, so it causing metabolic encephalopathy and brain edema. There is a maple syrup smell in the cerumen and urine. The infant present with lethargy, irritability, poor feeding and intermittent apnoea. If untreated early, death may occur due to brain edema. Older children present with epigastric pain, vomiting, anorexia, muscle fatigue, altered level of consciousness, movement disorder and ataxia. Second condition, intermediate maple syrup urine disease. It occurs in children between the age of 5 years and 7 years. The infant appear to be normal but will have maple syrup odor in cerumen and urine. Older children have poor feeding, poor growth and development. Intermittent maple syrup urine disease. There is normal growth and development. Symptoms occur only when there is an infection. Okay, these symptoms occur only there is an infection or a period of stress. Fourth condition, thiamine responsive maple syrup urine diseases. This one because of DPT gene is affected. It has symptoms similar to intermittent MSUD. If it is treated with high dose of thiamine and a restricted diet. How we can treat? High dose of thiamine. Treatment is by controlling the level of 3 amino acid and by following a restricted diet. Thiamine responsive. This maple syrup urine disease is managed with a high dose of thiamine and a strict diet. Next, inborn error metabolism, cystinuria. Cystinuria is an autosomal recessive disorder that occurs due to mutation of genes SLC3A1 and SLC7A9. So mutation of these two genes, SLC3A1 and SLC7A9. These genes code for protein complex that help in the reabsorption of amino acid cysteine in the kidney. The deficiency of this protein complex causes cysteine to be deposited in the kidneys, ureter, or bladder as crystal or stone, leading to signs and symptoms of cystinuria. Cysteine is formed when two molecules of amino acid cysteine are bound together and it is insoluble in urine. Cysteine is formed when two molecules of amino acid cysteine are bounded together and it is insoluble in urine. Signs and symptoms include blood in the urine, then flat pain in one of the side or back, nausea, and frequent urinary tract infection. Then treatment include restricted diet, reducing salt intake, medication like alkalizing agent which will increase the pH to dissolve the cysteine crystal, pain medication to control the pain while stone pass through the bladder and out of the body, and surgery for treating the stone. Next condition, homocystinuria. Homocystinuria is an autosomal recessive disorder that occurs due to defect in methionine metabolism, methylation pathway, or transsulfuration pathway due to deficiency of enzyme cystathionine synthetase, leading to accumulation of homocysteine and its metabolites in the blood and urine. The cystathione synthetase is an enzyme that convert homocysteine to cystathione. Its deficiency causes accumulation of homocysteine and its precursor methionine in the blood plasma. Signs and symptoms are mental retardation, spine sparse hair, skeletal deformation, displacement of the lens and eyes. Then vascular diseases. Treatment include methionine restriction and cysteine supplementation. Vitamin B6 and folic acid can be given. Beta-ine is a medication. Beta-ine is the medication that remove the extra homocysteine from the body and it can be given. Next, inborn error metabolism, cystinosis. Cystinosis is an autosomal recessive disorder that occurs due to mutation of CTNS gene that encode the protein cystinosin, causing accumulation of the amino acid cysteine within the cell of kidney, eyes, brain, muscle, thyroid, pancreas, and testes. Cystinosin is a lysosomal transmembrane protein. It is a lysosomal transmembrane protein that help in the transport of cysteine molecule out of the lysosome. So the deficiency of this enzyme causes cysteine to accumulate and form crystal in the lysosome, causing cystinosis. There are three types of cystinosis: nephropathic cystinosis, intermediate cystinosis, non-nephrotic or ocular cystinosis. So first one is nephropathic. It began in infancy and it causes kidney damage and poor growth. They develop a condition called as Fanconi syndrome, Fanconi syndrome, which means that their kidney cannot reabsorb some nutrient and minerals such as sodium and potassium, which is excreted in the urine. Signs and symptoms include poor growth, soft bowed bone, increased urination, thirst, dehydration, and acidosis. If untreated, kidney failure occur 10 to 12 years of the age. Second condition, intermediate cystinosis. The sign and symptoms occur during adolescence. There is deposition of cystine crystal in the eyes, leading to pain and severe photophobia, along with malfunctioning kidney. If left untreated, complete kidney failure can occur. Third condition, non-nephropathic or ocular cystinosis. It is adult onset and the affected person usually does not have any kidney malfunctions. Any kidney malfunction, but they have severe photophobia due to deposition of cystine crystal in the eye. Treatment to be give fluid and electrolytes, vitamin D and phosphate for weaker bone, kidney transplant, and administering cystine depleting medicine. Last one is isovaleric acetonemia. Isovaleric acetonemia is an autosomal recessive disorder that occurs due to mutation of IVD gene that codes for the enzyme isovalerial coenzyme dehydrogenase. Isovalerial coenzyme dehydrogenase. This enzyme isovalerial coenzyme dehydrogenase help to break down of amino acid leucine, and so its deficiency or absence causes buildup of organic acid called isovaleric acid, and it is related component leading to damage to the brain and nerve system. The sign and symptoms occur within few days after birth and in later childhood. The symptoms include poor feeding, vomiting, seizure, lethargy, low muscle tone, growth retardation, and in severe cases, coma and death may occur. Treatment include managing the symptoms and avoiding metabolic crisis. Supplementation with L-carnitine or glycine, which help to remove acid from the body by kidney, reduced protein intake and glucose through IV during acute attack hospitalization. Children should avoid fasting and infection as they trigger the condition. So these are the inborn error metabolism of amino acid. Thanks for watching.